thank you, Denise, for so kindly inviting me here to present. This is a very special occasion indeed because, as Denise said, this seminar coincides with the launch of the Center for Critical Qualitative Health Research, which is very exciting, and it is also a great honor for me to be sharing the panel with Katherine Boydell, whose work I do admire. A growing number of health researchers are turning to theatrical performance as an innovative approach to extending research findings beyond the discipline in which they were generated, and to communicate research findings in more engaging and captivating ways. With an interest in this aesthetic practice, I translated ethnographic research of mine on selfhood and Alzheimer's disease into a series of vignettes collectively entitled Expressions of Personhood in Alzheimer's. In my presentation, I will share with you my purpose of producing expressions of personhood in Alzheimer's disease, my rationale for using drama as a knowledge translation strategy, and some data from focus group discussions that I facilitated with dementia care practitioners that I feel illustrate the effectiveness of the vignettes in conveying the significance and the significance of meaning, habits, gestures, and actions for self-expression in the context of advancing Alzheimer's disease. Explicit in the current discourse on Alzheimer's disease is the assumption that memory impairment caused by cognitive deficiencies leads to a loss of selfhood. With the onset and progression of Alzheimer's disease, it is assumed that the self is becoming increasingly devoid of content. It is unbecoming a self. Approaches to caregiving, in traditional approaches to caregiving, the principles of practice are largely informed by the assumption that dementia is a disease that eradicates the essence of the person. This assumption negatively influences the way that healthcare practitioners interact with those who live with Alzheimer's disease. This is most apparent when we consider the depersonalizing tendencies of some treatment contexts and caregiving relationships. Many investigators have lamented the prevalence of negative attitudes towards individuals with Alzheimer's disease in nursing homes, and have, through their research, brought into sharp focus interactions that disempower, depersonalize, and invalidate an individual with dementia. If we are to move forward in developing humanistic dementia care practices, it is my contention that we must develop a new paradigm that respects individuals with Alzheimer's disease as deserving of dignity and worth. And I would like to stress here that I'm not suggesting that the recognition and support of embodied selfhood alone is sufficient to humanize dementia care. Contemporary logics of management practice that are concerned with standardization, cost reduction, those sorts of things, profitability, must figure prominently in any discussion of institutionalized care. And I do examine those in my work. However, I also argue that there are other factors in addition to staff ratios that affect quality care. And one of these factors is assumptions of loss of selfhood, and that is my focus here today. While the importance of recognizing and supporting selfhood in dementia care has been advocated by others, missing from efforts to humanize practice settings is an understanding of selfhood as embodied. Consequently, a significant dimension of existence in those with Alzheimer's disease continues to be ignored. Very briefly here, the notion of embodied selfhood speaks of a complex interrelationship between primordial and sociocultural characteristics of the body, all of which reside below the threshold of cognition and are grounded in the pre-reflective level of experience. It's a notion that takes its theoretical bearings from Merleau-Ponty's understanding of non-representational intentionality and the primordial body, and Bourdieu's notion of habitus, which links bodily dispositions to structures of the social world. Embodied selfhood is a concept that disentangles selfhood from the cognitive categories on which it's presumed to depend in Western culture. So selfhood, I argue, persists despite cognitive impairment by virtue of its embodied nature. So as a first step towards the development of dementia care practices that are premised on this notion of embodied selfhood, I designed a study involving focus groups with dementia care practitioners to explore with them the notion of embodied selfhood in the context of their practice and how this notion could enhance person-centered dementia care. When designing the research methodology for the study, I was keenly aware that for practitioners to reflect on the notion of embodied selfhood, an understanding of the notion would obviously be indispensable. So to achieve this most effectively, what I wanted to do was recover the experiential immediacy of the body that was present in my original ethnographic research on an Alzheimer's support unit, precisely because I felt that such immediacy powerfully disturbs commonplace assumptions about selfhood and Alzheimer's disease, and therefore would offer insight and stimulate discussion amongst the focus group participants. The active participatory nature of ethnographic field research privileges communicating bodies, thus enabling the researcher to attend to detailed speech and nuanced gesture. It's only by attending to the body and the lived world of everyday life that I, for example, achieve the insight that the sociocultural specificity of selfhood is visibly manifest in the way that the body moves, perceives, and behaves. But in translating the dynamic, intimate, and embodied experiences observed in the field into textual representation in my PhD dissertation and subsequent publications, I felt that to some extent the physical, emotional, and visceral, and also sensory dimensions of communication were flattened out. Anne Robertson isn't here. She was my PhD supervisor, and she could recall many meetings in which we discussed the challenge I faced in capturing in text how, for example, gesture so often served the purpose of conveying praise, thanks, support, affection, gratitude, sympathy, greeting, disapproval, blame, and so forth. In my field observations, slight head nods, eye and small lip movements, chin thrusts, shoulder nods, hand and finger movements, as well as leg and foot shifts were communicative and interactive. A short sequence of acts might signal for another resident's attention. A directed gaze towards another person, a smile, a lift of the eyebrow, a wave, and a quick head nod. Likewise, gaze avoidance signals a desire not to communicate, often accompanied by particular body movements or postures, such as turning away. Textualism can flatten the flux of human relationships. The ways meanings can create, the ways meanings are created intersubjectively, embodied in gestures as well as in words. In contrast to textualism, dramatic performance privileges the phenomenological complexity of everyday life. And thus, just as with participant observation, it too has the advantage of drawing the observer into a particular social and cultural world. As Denton argues, the performed text recovers the experiences previously represented in the ethnographer's text, and then represents those experiences as embodied performance. By doubling back on the original ethnographic experiences of being directly involved in people's lives, observing and talking with them, learning how they respond to situations, and how they organize their lives, etc., one can more vividly capture what otherwise can get lost in translation of participant observation into text. That is, gestures, movements, sounds, and textures of the lived world. Drama would allow me to make the experiential phenomenon of selfhood, as I had observed it in my field observations, present for the healthcare practitioners, thereby facilitating effective and intellectual understanding. Dramatic performance also creates a space to engage in social inquiry that resonates simultaneously with critique and the envisioning of new possibilities. Expressions of Personhood and Alzheimer's is a dramatic production that not only carries forward embodied expressions of selfhood and Alzheimer's disease, but also critically exposes depersonalizing tendencies of treatment contexts and caregiving relationships. Dramatically portraying interactions between staff and individuals with Alzheimer's disease facilitated the focus group participants' recognition of missed opportunities for healthcare staff to respond to and support the selfhood of persons with cognitive impairment in its embodied manifestations. Its purpose then was to raise critical awareness of how practice reflects underlying assumptions about dementia, and to engage practitioners to imagine new possibilities for more humanistic caregiving practices by helping them to meaningfully connect with their care recipients. The production consisted of 5 separate vignettes, which were thematically connected in that all featured bodily expressions of selfhood by severely cognitively impaired residents of an Alzheimer's support unit. The following 5 instances of observed occurrences served as the basis for the scripts of the vignettes. In String of Pearls, a female resident struggles to pull out a string of pearls from underneath her bib so that they could be seen by the other residents seated at the table, without staff ever responding to her proud display of her pearls. In Knowing Hands, a resident who has no recollection of her talent to weave repeats, "I cannot," as a program instructor demonstrates for her how to weave a canvas. But once the threaded needle is placed between her fingers, she proceeds to weave with absolute proficiency. In You Have to Eat, a resident who sees another resident seated at the dining table alone with her breakfast untouched gestures for her to eat as she peels for her a hard-boiled egg and removes the foil lid of her juice. In Sitting Shiva, a resident believes that her deceased husband, to whom she was married for 65 years, has just died. And she gestures to a nurse who tries to console her to sit Shiva with her. Sitting Shiva is the Jewish tradition or ritual of prescribed mourning following the death of a parent, spouse, or child, and the nurse does. Finally, in The Way Through, on the 8th day of Hanukkah, a party is organized for the residents, and following the celebratory lighting of the menorah, when staff begin to take the residents back to the unit, one resident resists. And while staff are busy tending to other residents, she slowly makes her way across the room in her wheelchair to where the menorah stands in full flame. And she covers her eyes and whispers a prayer to herself. The vignettes remained faithful to these in-life interactions because they so powerfully render visible how selfhood is expressed through the body. Selfhood as an expression of distinction, creativity, genuine caring, and is expressed through the reenactment of ritual practice, despite even severe cognitive impairment. These observed occurrences were reenacted in the production in order to offer insight and stimulate discussion amongst the focus group participants about the breadth and importance of nonverbal communication for self-expression by persons with severe cognitive impairment. The translation of the ethnographic research into dramatic form involved my partnership with Act 2 Studio, a theater school and creative drama center for older adults at Ryerson University's Raymond Chang School of Continuing Education. And I chose Act 2 Studio because it has a demonstrated history of developing socially relevant dramas for public presentation. 6 focus groups were conducted in 3 different academic healthcare facilities in Toronto. Each focus group consisted of 6 to 8 practitioners on staff at the given facility, with 2 focus groups conducted per facility. 43 practitioners, all of whom were female, participated. Nurses, occupational therapists, physiotherapists, recreational therapists, and personal support workers. The focus groups were each approximately 90 minutes in duration, 30 minutes for live performance of the production, followed by 60 minutes for discussion. The discussion was based on a series of semi-structured questions about participants' perceptions of the production, specifically their understanding of self-expressions by persons with severe cognitive impairment, through their bodily habits, gestures, and actions, and equally important, the response of the practitioners to the lack of response by the care practitioners depicted in the production. Participants were invited to compare and contrast the interactions depicted in the production with their own experiences in order to explore self-expressions by persons with Alzheimer's disease in the context of their practice, and the implications of recognizing or not recognizing such expressions for dementia care. The purpose of the focus groups then was not to evaluate the effectiveness of the vignettes in conveying the notion of embodied selfhood, but rather to explore the importance of nonverbal self-expression by persons with severe cognitive impairment and how the recognition and support of such self-expressions could enhance person-centered dementia care. However, in analyzing the focus group data, what I came to realize is that there are pertinent excerpts from the transcripts that do illustrate the effectiveness of the vignettes in communicating the breadth and significance of embodied self-expressions by persons with dementia. And it is these that I wish to share with you here. In reflecting on the ways in which selfhood is expressed through gestures of the body by the care recipients, Many of the participants referred to the vignette in which the cognitively impaired woman pulls a string of pearls from beneath her bib so that they can be seen by the others seated at her table. A recreational therapist recounted the importance of hats for the residents of a veterans facility. Hats. I find that hats, because I do a lot of outings, it's like, oh, we got to wear a hat. They're used to wearing a hat to go out, and then we enter a building, off comes the hat, And I used to do a lot of Legion trips. If anyone wore a hat to go into a Legion, they had to buy everybody a round of beer. So you see, once they're coming in, oops, there goes the hat, So some of those things that they've grown up with or have done their whole life stay with them. Again, the vignette depicting the woman with her pearls prompted a personal support worker to recount the following incident in the dining room of her facility. We have a resident like the woman with her pearls who's so nice and proper. I remember one time at breakfast, or maybe it was lunch, I can't remember, but what happened was a man burped so loud and a woman seated at his table was disgusted. She gave him a look I'll never forget, and just like that, she got up and left the table. She know you don't behave like that at the table. I said to myself, what a proper lady. So the personal support worker recognized the resident's respect for social convention in her disapproval of the improper behavior of the male resident seated at her table. So both the hats example and the example of burping demonstrate how one's primary socialization and cultural environment gives selfhood its sociocultural specificity by virtue of being embodied and materialized in one's habitual tendencies and inclinations to act in particular ways. The recreational therapist and personal support worker clearly recognized these behavioral propensities as signifying selfhood. Reflection on the ways in which care recipients manifest social etiquette continued with discussion about other social modes of expression by persons with dementia. For example, some participants recounted instances where a person's previous vocation instilled bodily dispositions to move and act in particular ways, and how with some knowledge of the life history of the person, they could recognize the meaning of such expressions. Reflecting on the vignette that depicts a female resident helping another resident eat breakfast, an occupational therapist spoke of a resident who continued to express her previous vocation as a stay-at-home mother through bodily movement and behavior. She's always wanting to help. I see her going into the kitchen all the time to fold the bibs, which usually sit in a pile there. She often tries to clear the dishes from their table. When everyone's finished eating, she scrapes and stacks the dishes, but kitchen staff make sure she doesn't carry them into the kitchen in case she drops them. Oh, I've also seen her follow the maintenance guy who cleans the carpets with that big machine. In the creative arts program, she's picking up beads that have fallen on the floor. The woman in the play who sees the other resident isn't eating her breakfast automatically wants to feed her. The client of mine, or this client of mine, would have done the exact same thing. It's as if they're still in their previous position or role from before they got Alzheimer's. She's a mom, so making sure everyone is fed is important. So these examples demonstrate that just as dispositions are embodied, so too is selfhood, which the nurse and occupational therapist recognized as manifest in the socioculturally specific ways that the residents moved and behaved. Creativity was yet another social mode of expression discussed in reflecting on the vignette that depicts a female resident's ability to weave in the absence of cognitive awareness of this ability. Many participants understood this expression of creativity to be a manifestation of selfhood. As a nurse commented, I can think of one of my residents who's resistive, difficult to care for at times, particularly in the morning. In speaking to the wife, we found that he loves to sing and that he was a choir member for years in his former days. So we came up with the idea to get him a CD player, and the family brought in some music. We put that on every morning just prior to care, and most times he sings along as loud as anything. It makes it less difficult to care for him, and sometimes we sing along with them, and he just gets right into it. He enjoys singing, and it's nice for us to see him express himself in this way. So it's like the woman in the play who weaves. Despite their cognitive impairment, they can express themselves in creative ways. A recreational therapist similarly commented on a creative expression of a resident in her arts program. There's a woman I'm thinking of from my practice who no longer speaks and who's so cognitively impaired she can't walk or dress or feed herself. But when she comes into my program and sits at her easel, you wouldn't know of her impairment. She paints beautifully with watercolors. It's as if she's communicating through her art. Participants described how the vignette about the Hanukkah party raised their awareness by allowing them to see a spiritual need through the enactment of a ritual practice, a need that they were not previously aware of. A physiotherapist, in commenting on this scene, noted the following: "I never really thought about this personal or spiritual need that people with dementia might have. The scene was very powerful for me because it made me realize that prayer, communion, ceremony, etc. are important even for people with dementia." Echoing these comments, an occupational therapist stated, "We have a chapel in our facility, but I've never seen anyone go down there. But what are we denying residents by not facilitating some organized prayer for them? The scene with the menorah made me think that maybe residents need some form of spiritual outlet that we should provide, maybe like an organized social program, or maybe we should bring the chapel to them for prayer." A recreational therapist was particularly moved by this vignette because, as she explains, it vividly depicts the need for personal prayer, a need that she was not previously aware of, and thus has not accommodated in similar such programs of hers. "I organize a Hanukkah party just like the one we saw in the play, and it saddens me to think how many times residents might feel the need to get close to the menorah, but this is never recognized. There's always chaos when the program ends and staff have to take the residents back to the unit, but to be able to step back and see what we are all missing in this chaos was very powerful. That scene really hit home for me because look at how peaceful the woman was at the end of the scene, because she had the chance to say a prayer at the menorah. She was resisting the staff before because she wanted to say her prayer, and once she did, she was fine. When I think about how many programs I've organized just like that one, and how many times such need might have been missed, we really have to pay attention to this." So in all of the data that I've presented here, the focus group participants clearly made a connection between the vignettes and instances from their own practice. And it's a connection that conveys both their understanding of the vignettes, but also their relevance for dementia care. So this was a very powerful affirmation of the notion of embodied selfhood. And in essence, the vignettes did exactly what I had hoped they would do. Post has argued that the Western emphasis on rationality and memory wrongly excludes people from dementia from the sphere of dignity and respect. He calls for a new ethic of dementia care that attaches no moral relevance to mental acuity or decline. Post is critical of the inequalities of a hypercognitive culture and maintains that will, emotion, and relational capacity must count as morally relevant features of the person whose rationality and memory has faded. Building on Post's critique, I argue that embodiment, too, must be recognized as a fundamental dimension of human existence that is essential to the manifestation of selfhood. The findings that I've presented here suggest that using dramatic performance can foster awareness and deeper understanding of the ways in which persons with dementia remain connected to the world. Central to my research agenda is to create a new ethic of care that respects individuals with Alzheimer's disease as embodied beings deserving of dignity and worth. And I do believe that dramatic performance and its aesthetic practices can facilitate the transformational shift needed in order to achieve this. And I would like to gratefully acknowledge the funding that supported this research, the Collaborative Research Program, Canadian Nurses Foundation, and Nursing Care Partnership. At the time that I did this research, I was a postdoctoral fellow, and I was supported by a CIHR postdoctoral fellowship. And also the Healthcare Technology in Place, which was a CIHR strategic research and training program, also supported my postdoctoral fellowship. And I'm currently supported by a CIHR New Investigator Award. So thank you for your attention, and I think that there is time. I wanted to show you one of the vignettes. I mean, I'd like to be able to show you all of them, but there's not time for that. So if I can figure this out.
Is the media player?
Yeah. Do we want to dim the lights? Mm-hmm. Yeah, maybe just to. Oh, is it over here? Oh.
It's there. The other way around.
Okay.
Yeah.
Is there a way to make this bigger?
Yes.
Good morning, Mrs. Brown. Would you like some more tea?
Double click on the screen.
There you go. Hi, I'm running behind my schedule. What do you want to feed Mrs. Henderson for?
Double click on the screen.
Sure.
Sorry?
Double click on the screen.
Oh, double click on the screen.
Good morning, Mrs. Henderson. How are you today? There. Got some nice cereal for you today. There we go. Oh, you don't need your napkin, Mrs. Henderson. Your bib covers your lap. All right, I'll help you. There we go. Is something wrong with your bib? There shouldn't be. It's the one you always wear. Let me check. It's not too tight. Thanks a lot. I thought you said Mrs. Henderson was going to be easy to feed. She's being very resistant today.
That's strange. She usually really enjoys her breakfast. Where's Mrs. Zimmerman's bib? I don't have time for this. I still have to get Mrs. Schwartz.
I'll get you one.
Thanks, Jennifer. You're dull.
I'll be right back, Mrs. Henderson. Here you go. Now you can enjoy your breakfast. Okay, Mrs. Henderson, your cereal must be getting cold. Let's try this again. There, see?
Of course, she doesn't see it all. So. Okay. Okay, so, Katherine.
Okay, thanks very much, Pia. That was a great presentation. It really demonstrated the power of the visual. So I'm going to take it from there and be talking about what I think is the tremendous power of the visual, but using a very different genre, that of dance. And I'd like to start off by acknowledging the research team, the creative team that were involved in this co-creation that I'm going to be sharing with you this afternoon. And to really stress the fact that this was a co-creation and involved so many people, and I guess embarking on this with the idea of wanting to use dance to convey research findings, really to involve musician, photographer. I mean, I had no idea in terms of the outset of this project how many individuals would be involved, and this in fact is not even an exhaustive list, but really do want to express my acknowledgement to the team. My research team is sitting here in the front row almost, giving me support. So it was fabulous and a privileging experience to work together with this group of individuals. The objectives of my talk today are really to build on what Pia's been talking about in terms of extending the boundaries of academia. I was really interested in moving beyond typical academic ways of translating our research knowledge and thinking about ways that might be more powerful, thinking about the different audience members that we wanted to reach in so doing. So really wanting to use the arts to communicate empirical research knowledge to a group of audience members beyond academia. So really interested in reaching out to educators, to young people, to the general public, to service providers, and I'm going to talk a little bit about each of those groups as I move on through my talk. One of the things that I found once embarking upon this research is that the process piece was just as important as the product. And I want to convey that to you today as well in terms of trying to share with you a little bit about that process of creating the dance. Because as a researcher, it was, well, we've got to measure how this is being created as well. So how do we go about doing that? How do we share that process with others? How do we work together to determine what are the elements of the research that we're going to share visually through movement and through music? And that was just as important as the final product that we wanted to use as a knowledge translation and dissemination strategy. So one of the other areas that I want to talk about this afternoon is how do you measure the impact of sharing research in this way? So my colleagues and I are very interested in questions around measuring impact, and impact, as you might imagine, on very different audience members. Just a little background on arts-based research. Certainly, when we think about translating research knowledge, there are many venues open to us, and certainly the arts has been, in the last decade or so, lots of research has proliferated, and it's been mostly in arts education. So it's been in the educational field as opposed to the healthcare field. So it's only in the last few years that arts-related research has been applied using health research. Certainly, my colleagues and I and others in the arts feel that that it's critical that the arts is very powerful and evocative in terms of sharing research knowledge. And I think particularly the types of research that we're doing in our work, which are very experiential. We're working qualitatively. We're dealing with people's stories, and so that's very important. Pia, I noticed that you mentioned Norm Benson earlier on, and I just love this quote of his, and it really resonated with what we were trying to do in this project. He stated, "Performances deconstruct, or at least challenge the scholarly article as the preferred form of presentation and representation. A performance authorizes itself not through the citation of scholarly texts, but through its ability to evoke and invoke shared emotional experience and understanding between performer and audience." So that statement really resonated with me. Now certainly photography, music, poetry, video installations, drama, and theater presentations have been added to the qualitative researcher's toolbox of late. And Jones in the UK talks about performative as being a working title for some of the dissemination efforts of researchers wanting to enhance or move beyond traditional presentations and journals. And dance has been a very underrepresented genre of arts in this work, and in fact, those who have used dance to communicate research results have been in the educational field, and most of them have been dancers themselves. So you might be familiar with the work of Kansian and Bagley, who are dancers themselves, the work of Cole and McIntyre, and Blumenfeld-Jones. And again, all working in the educational field. And I think one of the things that's been really interesting with this group of researchers is that they've been very cautious about the use of dance to communicate research results. So they've taken their research and been quite literal with the dance, and they followed very closely the text. And so for my colleagues and I, we were wanting to explore a little bit beyond that and take more risks than that around the interpretation. And I'm going to talk a little bit about that because that's been a struggle in the co-creation of the performance that the creative and research teams have worked with. So I'll be addressing that. In terms of dance, why dance? It really was a blending of my personal and public worlds. As a scientist looking for ways to share research findings to multiple audiences that might be meaningful, evocative, I really wanted to provoke. And as a mother of 3 daughters who were deeply immersed in dance and spending endless hours in studios and at competitions, watching dance after dance and being really moved by a lot of these performances and sitting in the audience and thinking, well, this isn't even research. What if we tried to use this movement in music to really convey some of the research results that we're finding in our work? Is that a possibility? So certainly I was very interested in doing that. Also the fact that dance is a universal language, and that held a lot of meaning for me as well. So really it was the power of dance to communicate a story. The parallels with the aims of qualitative research for me were many in terms of structure, content, form, and meaning. In fact, I think there was an article that was written by Blumenfeld-Jones detailing in a quite nice way the parallels between qualitative research and the choreographic process. So again, lots of similarities there. And so the research questions that we embarked on when we started the project was it possible to develop visual ways to communicate research findings about complex subjects like psychosis? In what ways could expressive bodies, performance, be used to represent qualitative research? And could it challenge us to engage differently with the data and to see differently? So those were some of the key questions we had. I'm just going to tell you a little bit about our program of research in first episode psychosis, so you can get a sense of the research upon which the dance performance was based. It's a program of qualitative research in first episode psychosis, and we also focus on young people who have been identified as being at ultra-high risk of developing psychosis. And we certainly know that young adults aged 18 to 24 suffer more from mental illness than any other age group, and yet they're least likely to seek help. And this was stressed in the Canadian Community Survey in 2003, and also as recently as last week in the Toronto Star article. I don't know if people had an opportunity to see it last Saturday. And again, really highlighted the issue of young people and the mental health challenges that they encounter, but also highlighted the fact that they are the least likely to seek help. So our program of research in early psychosis is really focused on this help-seeking process. First episode psychosis has been identified as being a critical period for early intervention to prevent further episodes of psychosis and potentially prolong any diagnosis of potential schizophrenia. So certainly it's an important area to focus on. We know that there's a long delay from the first early and subtle signs and symptoms of psychosis to treatment, and again, that's a problem in terms of the need to access young people at an earlier point in time. Some secondary analysis of our own team's research with young people and with their family members showed that, in fact, young people talked about actively hiding and avoiding some of the earlier subtle symptoms of psychosis, and in fact would lead us to believe that it might even be longer than the 1 to 2 years of that duration of untreated psychosis. We also found that there was a pervasive influence of others, significant others in the social network, again, that had been largely ignored in a lot of the literature. So what role do these other people have in this pathway to mental health care? So the study upon which the dance performance was based was funded by CIHR. It was a 3-year study focused on trying to explore some of the issues, some of the barriers, some of the challenges in accessing formal mental health treatment for young people experiencing the first episode of psychosis. It involved a series of in-depth case studies with 10 young people, and everyone in their network that they identified as being important in that pathway to care, whether they were a help or whether they were a hindrance. So we asked their permission to also interview them. So for each case, we had up to 4 individuals who were also interviewed to talk to us about their role in that pathway. We were also interested in elaborating on a network episode model of help-seeking that was published by a sociologist, Denise Pescasolido. So that was a secondary goal of ours as well. And again, really focusing on the process of help-seeking, and we were very interested in that. Now, when we were putting together this project, we were sort of at the preliminary results stage, and we felt that it's really important when you're thinking about knowledge translation and exchange that you don't just wait until the end of a study to disseminate results, but that it's a process, and we wanted to share at this point some of the results that we were finding in our pathway study. And what we found was that there was certainly a richness and depth and complexity to the pathways. We found that each individual pathway was very unique, and in fact we had created schematics of each pathway. And they were very complex, showing the various roadblocks, areas where people were involved, what was going on in the young person's life at the time. And we had 10 very distinct schematic visual representations of the pathway to care. But yet when we looked at these individual pathways to care, we found common universal elements across all of them as well. So one of the things that we really wanted to capture in the dance performance was the particularity and universality of the experience for young people and those involved in their network. We found that there were lots of people involved in the network, lots of help-seeking activity going on, but again, multiple roadblocks. We found that individuals in that network rarely communicated with each other, so certainly there were lots of missed opportunities in that help-seeking process. Now, in terms of the co-creation of the dance itself, this was a really important component. It occurred over a 6-month period of time. It involved interviews, not even interviews, I should say meetings between myself and the choreographer, between the research team and the creative team, which involved the dancers, the musician. So there were lots of meetings and activities going on that we audio taped. We took reflexive field notes, the choreographer, musician, dancers not so much. And also lots of observations. So as I was going through, really interested in the process of developing and co-creating this performance. We were interested in analyzing the collective interchange among the individuals that were involved in this co-creation. And I presented a paper last week on just this co-creation of the performance using a symbolic interaction approach and really looking at the co-creation of the dance as a collective event, and really trying to focus on how players in the creative and research teams define and redefine our mutual definitions of the situation as we were moving through developing and co-creating this dance. We actually drew on some of your work, Pia, and your colleagues, and Rossiter, in terms of the narrative dramatic coding of the transcripts. And this really identified text that was used to develop the script. It was used very much so by the dancers who were really trying to understand the experience of young people because they were dancing as this. They really wanted to understand in a deeper way than I had imagined. So when I think back on some of our meetings, really asked a lot of questions about the experience of psychosis. In fact, the creative team had to become members of our investigative team and go through our research ethics board process so that they could have access to the summaries of our transcripts. So very intent on understanding the research findings in a way that I hadn't anticipated when we started out with the project. Certainly it was an unfolding process characterized by ongoing negotiation. And as I mentioned previously, one of the elements that was a real struggle for me was the balancing of trying to convey the empirical research results, but also wanting it to be creative and thinking about the interpretive process and how do you balance that. And I just have a couple of quotes from our field notes from myself and the choreographer that kind of reflect this sort of ongoing desire to balance. I write, I felt the tension of trying to balance my input into the product with what was shown at the beginning and excited at the same time. Nervous as I struggled to understand Katherine's world of writing journals, conducting research, and the constant discussion that sometimes went over my head. I kept reminding myself that I was someone who has analyzed, observed, and produced in physical form, using the body and music to experience a world that is used to using text. So again, lots of working through managing some reservations, taking risks. How would this look as an academic in terms of my taking on this work? What would my colleagues think about some of the out-of-the-box work that I was trying to do? And I think particularly working within the Hospital for Sick Children, which is typically a traditional research institute. So I must say I did receive a lot of support from the institute, my own institution. In some of the earliest meetings between the choreographer and myself, I was trying to convey to her some of the key words. She wanted words. So the first question she asked me was, give me words, I need some words. What can I work with in terms of words? And one of the things I really wanted to illustrate was this dialectic in terms of what we were finding. I wanted to illustrate the universality of the experience, but I also wanted to highlight some of the particular stories and how could we do this throughout the dance. So I think that that was really helpful in terms of working through some of the details of how the performance would unfold. And again, just from my field notes, it was important to me that Shona convey the isolation, the uncertainty, the fear, the hopelessness, but also to highlight the hope, the joy, the connection, the moving beyond the illness. She choreographed the final moments of the performance to reflect the journey as being different for each character. Some move forward, some do not. Okay, so what I wanted to do was, oops, sorry, I didn't want that to go yet. I just wanted to give you a bit of context before I show you a 3-minute clip of the performance. The performance ended up being 15 minutes. And what was conveyed in the performance was some of the major themes that arose from the study, but we also wanted to highlight a couple of the particular stories. And again, the struggle for how much do we help the audience along. And what we decided on in the end was that we moved throughout the performance with different moments, so that there were moments where it was more open to interpretation, and there were moments where we helped the audience along a little bit in terms of the voiceover. So in the clip that I'm going to show you, this is one of the dancers is incorporating his solo as part of this piece, so it's the story of one young man in our study. And I think it's also important to note and to highlight the fact that the musical score that went along with the dance involved about 200 hours in the musician's studio, and he worked really closely with the choreographer and the dancers and myself in terms of really trying to understand the study, again, making sure that the music went with the movement. And it's his voiceover and his singing in here as well, Tina Sherwood. So I wanted to acknowledge him as well. So I'm going to show you the 3-minute clip and then talk to you a little bit about measuring the impact of the performance and some of the experience we've had in doing that. I'm hoping I still have a bit of time, because I notice you're here.
Going to pass away.
It's going to pass away.
I didn't. They asked me, but I said, nothing's wrong, everything's okay.
Nothing's wrong.
I was in denial.
Everything's okay. I was in denial.
I'd say I started having paranoid feelings about a year ago. If I really think, things started to happen little by little. They gradually got worse. I didn't notice because I thought the way I felt was right. My parents didn't notice because it was so gradual. When it first happened, I really didn't know for a while, so it was alright.
I didn't notice because I thought the way I felt was right.
And over time, I stopped talking to my friends.
When it first happened, I really didn't know for a while, so I was alright. Over time, I stopped talking to my friends.
I didn't go out, I didn't do anything, I skipped school. Because, I couldn't take it. I didn't know what was happening to me. I thought I was having a heart attack or something. I didn't even bother telling my friends much because I was so consumed.
And I'm sorry I couldn't bring the dancers live here today. They are actually performing as I speak at Sick Kids, at Kids Science Day, to a group of 150 at-risk secondary school students. So they are performing today, but in terms of the power of the performance, to see it live, I think, is even more powerful, because there are lots of moments in the performance where there are moments of silence, there are moments of breathing, and it's really hard to pick up in the video itself. The performance that you saw there was premiered at a conference on early psychosis about 1.5 years ago, and we really didn't imagine it would move much beyond that, and certainly it has. And I just wanted to share with you some of our efforts at trying to measure the impact of using dance in this way. The symposium itself was composed basically of academics and service providers in the early psychosis field. And in addition to our typical, tick box Likert scale evaluation, we had in individual participant programs a sticky note. So following the dance performance and just prior to the break, we had them write down a series of words, sentences, to depict how they immediately felt following the performance. And what we had them do is when they walked out of the room, we had a large white board, poster board, and we just had the delegates stick their Post-it notes on the board so that they could sort of interact with it throughout the day and become a sort of a discussion point. And so we had these 100 and some odd Post-it notes with feedback, which for me really indicated that there was something there in terms of moving people, particularly service providers who were working with these young people on a day-to-day basis, who talked about seeing something that they hadn't seen before, or calling to mind something that hadn't been there before. So I just wanted to share with you one of them here that I've highlighted in yellow. This is a service provider working in early psychosis. Pain trying cycles alone, not disconnect, break, broken, flee. So much pain that as a professional I can't feel with every person because I'll drown. But this reminds me why I do my job, reminds me how I should. Words aren't enough to understand. And I have to say that a lot of these sticky notes, we actually took note of the way the words were written on the sticky notes, because some of them were quite beautiful and poetic, and so it was really quite lovely. So since then, through word of mouth, because certainly the funding that allowed us to create the dance in the first place was just leftover knowledge translation funds from CIHR grant, so it wasn't a lot of money. And we'd been invited following the symposium to a number of events where we were able to target not simply other academics and service providers, but young people themselves, people in the creative arts world as well, and we were able to do the same thing for all of these varied audiences. So at the end of the day, we have like 600 sticky Post-it notes from all of these different audiences in terms of talking about their impact, and we've been thinking about ways to more systematically measure the impact that this might have on uptake in various populations. So for us, a particular interest is our young people audience, because we really feel strongly that this venue, this genre, has the power to educate and create awareness about psychosis, which is really critically needed. So that's certainly where we're evolving in terms of our thinking. In terms of knowledge translation, it was picked up by the International Early Psychosis Association and was featured in their International Film Festival last fall. There's a book chapter in press that talks about the co-creation of the dance. An article in Canadian Medical Association Journal that was written by a medical writer. So it was kind of interesting that other people have taken an interest in this. An article in the Toronto Star last year, and on and on. So there have been lots of opportunities in terms of sharing this. And I guess what we're most excited about is being formally funded by CIHR to actually allow us more resources to actually take the dance performance to 4 inner-city secondary schools and really have the opportunity to more systematically engage in a post-performance talk-back with young people, to hold focus groups with young people and with educators following that, to really get a better sense of what potential and impact using this arts-based method might have. As one of the one of the gigs we've had over the last year has been taking it to an all-girls private school, and there were 650 girls in the audience with all of the educators in the school as well. And it was the first opportunity that we had to not only introduce the dance perform, but we had the dancers and myself sitting on the stage afterwards and being able to engage with young people and listening to some of the questions that they had about the performance. And so we're really looking forward to taking this on the road, so to speak. So what I put up here were just some discussions that I think would probably apply to both of our talks, but really are the arts an effective means of capturing the particularity and universality of experience? Is there a potential to serve as a catalyst for dialogue and collaboration? Does it contribute to empathic participation in the lives of others? Is it an effective knowledge translation strategy? And Joan, your question that I'm fascinated by, is science enriched, dumbed down, de-theorized? So those are just potential discussion questions, and hopefully we'll have time for a little bit of conversation.
I would like to thank both presenters for fascinating presentations and invite Pia and Katherine to come back to have a conversation. So, yes, if you can. Barry, it's okay now for us to stop the podcasting.